When we assembled today's show, Salmon Hash, Southwestern Salmon Hash, all Kaufman one diet. You gotta wait 30 minutes to get it. Abby's over in the kitchen doing that. Antibiotics and probiotics, yeast overgrowth, we're gonna talk about those things. One of my favorite dentists, he's in San Diego, California, Dr. Kerry OReilly is talking about, I found this fascinating, electric toothbrush or a manual toothbrush, gum cleaning, etc. He's gonna be here with us. And then finally, I saw on a medical website I subscribed to a headline that said, irritable bowel disease in children doubles their risk of cancer. And I thought, really? Is it the disease? Or might it be what we're using to treat the disease that increases the risk of cancer? Watch.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate. You know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
Folks, I worked a lot clinically with several great physicians. I learned a lot from them. One of the roughest things I ever used to see is irritable bowel diseases or irritable bowel disorders, IBD, Crohn's disease and the like, usually afflicting young people, 25 years and younger, and just horrible problems. I came across a headline, brand new paper just out a few weeks ago. And as I read that, it was on one of the medical websites I'll reference, I thought, man, this is amazing. Doctors are really good people. They became doctors to help people. And they're missing something so huge. And I want you to know this in case you have a grandchild, a daughter, a son, or you or your wife, your son, your grandma have this problem. Let's go over it. Recent irritable bowel disease headline. This came out of MedPage Today, April 3rd. IBD in youth may double cancer risk in later life. And then I read the subheading, exposure to common treatments did not increase the risk. Really? There are none so blind. Always work with a doctor. I'm not a doctor. I'm the guy who gives you the other side of the story. If your loved one is seeing a gastroenterologist right now and doing dandy on treatments, certainly we have a saying in Texas, when you find a good horse, you ride it. You found a good horse, stay with it. If you're not, and you're hoping, you're praying for an alternative, let me just go over this with you. But what these doctors are saying is, not our treatment. It's just these kids develop cancer at double the rate as life goes on. Could our treatment have been the etiology, part of the cause of their cancers later in life? So I looked it up. I went to the Mayo Clinic. What are the common irritable bowel disease treatments? Anti-inflammatory drugs are often the first step in the treatment of IBS. So these are steroids, Immune system suppressors work in a variety of ways to suppress the immune response that releases inflammation-inducing chemicals into the intestinal lining. And then antibiotics may be used in addition to other medications or when infection is a concern. Okay, so you got it. Steroids, antibiotics, and immune system suppressors. I'm scratching my head. You're kidding. If we have an immune system, are we inducing immune suppression with some of these drugs? One of them is cyclosporin, the tissue rejection drug when you've had a liver or a kidney put in your body, right? This is a powerful drug. We're suppressing the hush down immune system. Okay, so I did a little work. And on rare occasions, these drugs might injure. Okay? Here from WebMD, anti-inflammatory steroids. Millions of people who take immune system suppressing steroids like prednisone to treat a wide range of inflammatory diseases may be at an increased risk. Does that say for developing certain cancers? Okay, let's go to the next one. This is from Medical News Today. Antibiotics may increase the risk of bowel cancer? Wait a minute. Children who have irritable bowel disease go on to get cancer. Don't worry, it's not our drugs. Anti-inflammatory steroids may increase the risk for developing certain cancers. Isn't that what these kids have? And antibiotics may increase the risk of bowel cancer. Folks, okay, next graphic. Immunosuppressive drugs make the immune system less, this comes from cancer.gov. These are the authorities. Immunosuppressive drugs can make the immune system less able to detect and destroy cancer cells or fight off infections that cause cancer. I gotta tell you, they're wrong. They're just wrong in that opening. It's not our drugs. Oh no, it's something the kid is doing. If it is a yeast problem, which I believe, please talk to your doctor about yeast. If it is a yeast problem, then their sugar cravings and their pasta and their bread, and when they get 21 years old, their alcohol is just pouring fuel on a fire. But these drugs may have been the match, okay? If irritable bowel disease, it is irritable bowel disease that doubles the risk. Oh, my question, I'm sorry. Is it irritable bowel disease that doubles the risk of cancer later in life, or irritable bowel disease treatment that doubles the risk of cancer later in life? Please, I implore you, always talk to your doctor about fungus. This is so important, I can't even tell you. You must, if you have a loved one with irritable bowel, if the doctor says no, he's not reading his medical textbooks. Okay, here's what I would do. If I had IBD, and I thank God I don't, I would immediately talk to my doctor about taking prescriptive nystatin. Nystatin is a safe, it's found in the soil, a safe anti-yeast medication that works in the gut. Then I'd try taking following an antifungal diet that avoids feeding gut yeast that many rounds of antibiotics may have caused. Then I'd begin taking a good, clean probiotic regularly. Then I'd begin looking at and taking psyllium fiber nightly before I went to bed. I'd talk to the doctor about using an antimicrobial like olive leaf extract daily. Folks, when you have a serious autoimmune disease, not only you need to think outside of the box, you need to find a doctor who isn't a robot at prescribing. Please, it may really help prevent very serious ramifications a few years down the line. Friends, I'm joined by a friend right now. His name is Kerry OReilly. Dr. O'Reilly is a dentist, graduated from USC Medical School back in the 1980s. He has become a friend of all of us here at Know the Cause. And I want to talk with a dentist. Dr. O'Reilly, thank you for being on. And,
you're so welcome.
You're so kind to take
I love
this
your
time.
show.
Oh, I love everything you do. How does a dentist take care of his teeth? The one thing my dentist keeps saying, you know, when I go in for a cleaning is, you're what, 70? And these are still your teeth.
Yeah.
These are registered as antiques now, so congratulations. You're a holistic dentist. myholisticdentist.com is where you can get more information. How do you, personal question I know, and I don't mean to call you on this, but what do you do in your family? What do you guys do?
Yeah, me personally, how I clean my teeth, and this is so important, Doug. You need to do something to improve your health every day, and this is one of those things. This is definitely a way to improve your health, taking care of your mouth because of the inflammation here that's always there. So if you do something daily, you're going to get better. Your body will heal better. So what I do personally is I'll do the brushing, and I don't over brush. I don't over focus on the brush because I have other tools. Most patients have this misconception that the brush is the tool to clean all your teeth, to do everything. That's absolutely not true. The brush is just one thing. It's the first step. It removes most of the debris. So you can brush maybe for 30 seconds or a minute, and that's enough to do that.
Do you use an electric brush or just a manual?
I use a manual.
Okay.
Because I know how to use it.
Yeah,
most patients use an electrical because they don't know how to use the manual, which is just fine. Sonicare is a mechanical toothbrush. It's good, but it's a little aggressive. When you feel that thing vibrate, it's a power tool, Doug. That thing will wear your gums away if you brush with it with any pressure. You have to be very careful with electrical toothbrushes.
Good point.
So you brush along on the tops, obviously, and you brush the gum line lightly. You go around, massage the gums with the brush, right? Everywhere, inside, outside. And then what I do is I use floss next. And I get a big enough piece to wrap around my fingers so I can control it. So you don't snap it through the contacts and hurt your gums. That's what patients hate about flossing. It hurts, they can't do it, they can't control it, and it causes bleeding. So get control of the floss, real tight with your thumbs, and you go in and lean it each way in the contacts, right, to get the plaque off that way. You can feed it through a little bit progressively and move down the floss if you want to. I demo this all the time in my practice for patients. I have to show you how to do this, but long story short, flossing is important, okay, for between your teeth. And then I have a tool, it's called a rubber tip. It's an old-time rubber tip that used to be on toothbrushes.
Yes.
And it's a great tool for getting the plaque off your gum line. Is where it sticks. It's sticky there. That's why people overbrush, to remove that plaque. But the rubber tip is the right tool to do that. And you go along, just go along the gum line and wipe it off instead of brush it off and cause recession. Over the years, this will not cause recession. It'll remove the plaque correctly and safely. Those three steps are the basics that you should be doing. Sorry about this, folks. Every day, once a day, really well. And you don't have to be an A+. You can be a B+, but do it every day. That's the secret of dental health and health in your mouth.
And you know what? I love what you're saying, because dental health, folks, take it from this very smart man. Dental health is thorough health. It's not just mouth. You know, you worry about when you get your teeth clean, breaking away fungus or bacteria or viruses, and boom, into the pericardium, into the heart, the circulating through. What he's talking about is an ounce of prevention. And you need to do this every day. Dr. O'Reilly, it's always good to see you. Thank you so much for sharing that education with me and with all of us.
You're welcome.
You know, I have been a studier of fungus since I got back from Vietnam. I came home with, you know, some growth all over my body, right? Jungle rot all over my body. I found out that was a mycobacterium. I don't know what that word means, but a doctor will tell you that's a bacteria that behaves like a fungus. I believe it's a fungus that is sometimes mislabeled as a bacteria. Trust your doctor. I'm an entertainer, okay? I bought this book for $1 in the 1980s. It's called The Fungus Fighters. If you can get your hands on a copy of this book, it's all about two female doctors who really didn't get the credit they deserved in the 1940s and 50s. Doctors Hazen and Dr. Brown, you almost get to know them here by reading this book. They discovered nystatin. And they discovered it, along came antibiotics. And all of a sudden, kids and adults, everybody in the late 40s, early 50s, tummy problems, they cleaved nystatin. They were in Albany, New York. So the name of their drug, New York State In, or nystatin. It's still on the market today. They cleaved nystatin on the antibiotics. It made perfect sense to me. But somebody called for that not to happen anymore. Just give them the antibiotics. Without the antibiotics, antibiotics are good bacteria killers. Without the nystatin, I mean, the antibiotics are indiscriminate bacteria killers. Well, you have good stuff there, lots of it. Away it goes, boom, when you swallow antibiotics. Okay, I want to talk to you a little bit about this because it's hugely, hugely relevant. If today, as an adult, bloating, belching, gas, constipation, diarrhea, indigestion, GERD, you know all the big words that they use in medicine without understanding the etiology or the cause. Think fungus. Center for Disease Control is telling doctors for 3 years in a row now to think fungus. When those pills aren't working, gee, maybe it's not a bacterial problem. Think fungus, okay? That's what doctors Hazen and Brown did in the 1940s and I can't believe I paid $1 for this at half-price books. A tremendous book, The Fungus Fighters. Google it, find a copy. It's short, it'll blow you away. If you believe, like I do, that fungus causes a whole lot of health problems. Richard Baldwin, I think, wrote it. Yeah, Richard S. Baldwin wrote it. Two women scientists and their discovery. Huge discovery. If we all would take, doctors won't allow this, and I'm not recommending it, if we all would take nystatin for a month, a powdered, cleaned up nystatin for a month, I think gut diseases as we know it, I believe many of them would just dissipate because we've all been on antibiotics. Here we go. Here's my presentation. Do antibiotics cause yeast overgrowth? Here are 3 papers. Antibiotics are major risk factors, and numerous research papers have documented that increased use of antibiotics is associated with significantly greater risk of invasive or overgrowth of candida, which is a yeast in the intestines, mouth, vagina, and vulva. Folks, these papers, when you read these papers, it kind of blows you away. You mean doctors don't know this? It's not good to have yeast overgrowth. Well, Doug, it's a little vaginal yeast, little jock itch, little fingernail fungus. Wrong. Those are topical fungal problems. These are internal. We call these systemic mycoses. If it's in your liver, if it's in your lungs, if it's in your adrenal gland, your brain or your heart, your pericardium or your kneecap, you're going to suffer. And you're going to run from doctor to doctor to doctor. And they're going to say, well, that'd be $500. We really don't know. God bless them, folks. These are good people who didn't learn in their medical training clinical nutrition, how to apply nutrition as a thumbprint to every patient that comes in, or clinical mycology. What Doctors Hazen and Brown discovered 70 years ago, doctors don't understand. Okay. How is yeast overgrowth determined? The use of antibiotics which kill bacteria can significantly increase the level of this yeast, candida, and other yeasts in the intestine. A Greek study treated 40 cancer patients with 1 of 4 antibiotics. Okay. The use of these antibiotics increased the stool concentration of yeast by 10 to 10,000 fold. Okay. Isn't that fascinating? And these people had cancer. I think antibiotics and cancer sometimes, science says, the more antibiotics you take, the higher your risk of certain types of common cancers. So just be careful out there. Now, what do you do for this yeast overgrowth? I learned this 35, 40 years ago at a health fair in Los Angeles, right? There weren't many people there, but there were people with what looked to be cottage cheese, and it's called probiotics. Look at this. A number of earlier studies have reported that oral consumption of probiotic bacteria such as lactobacillus and bifidobacteria can reduce the risk of both candida-related digestive problems such as diarrhea and female candida infections. 2 recent papers have documented that oral probiotic therapy can be useful in both young and old patients. I really want this to sink in, okay? When I say lactobacillus and bifidobacteria, oh, those just happen to be in one of the best-selling probiotics. How do I know that? They have advertised on Know the Cause for what? 15 years. Okay, it's important that you know. Tummy problems, were you on antibiotics? Doctors don't understand it. This could be a gut fungal problem. Try probiotics and a changed diet with your doctor's permission.
Hi guys, my name is Abby. Welcome back to my kitchen. I'm going to show you how to make a really simple but really tasty salmon hash. Now this has salmon fish. If you don't like fish, I understand, but trust me, this is a really good dish and you're really going to want to try it. It's got a lot of really good flavors in it. Let's go and get started. I've got about 1 pound of fresh, roughly chopped salmon in a bowl, and I'm going to add in some already chopped up red bell peppers. I know these are Doug's favorite. I've got a whole chopped up jalapeno. I took out the seeds and I took out as much of the veins as I can. If you want it to be a little bit more spicy and get more of that jalapeno flavor, leave some of the veins in. I've got some chopped up white onion. I've got some already cooked quinoa. This is just simple. I just cooked it in some water, nothing to it, no extra spices or anything like that. I've got some chopped up, some coarsely chopped up cilantro. Now, if you're one of those people who doesn't like cilantro, it kind of tastes like soap to you, you can leave this out, that's okay. 1 lightly beaten up egg, just as a little bit of a binder. And then the juice of half of a lime. And then you're just gonna add some salt and pepper to taste. All right, now I'm gonna get my stovetop going. I'm gonna heat up my pan to around medium-high heat, put a little bit of olive oil on, and then I'll mix everything up and throw it on top of the pan. While my pan is heating up, I'm just gonna give everything a really good mix so it's all nice and incorporated. Make sure you get that egg mixed around everywhere. That's ready to go. Now I'm gonna put some olive oil in my pan. Bit. All right, and now I'm just gonna dump everything from my bowl into my pan. Now what you're gonna wanna do is you're gonna wanna let that cook undisturbed for a couple of minutes and then slowly start to stir it around to make sure you get all the pieces of salmon cooked, and as they cook, they're gonna start to break up a little bit and it's gonna be kind of like a hash, pretty much. Okay, it's been about 10 to 15 minutes, depending on how hot your pan is, but my hash is pretty much done. I'm letting it cool off just a little bit because it's still pretty hot. So while it's still in the pan, I've got a bowl of already cooked cauliflower rice. Now this is just a normal cauliflower rice that I could buy from the store. I just cook it on the stovetop, put a little bit of garlic salt on top, and I'm ready to go. But I'm gonna put a little bit of this salmon hash on it, and I think it's gonna be fantastic. Now, this hash can go on top of anything. If you want to use sweet potatoes, you can use sweet potatoes. If you want to use the leftover quinoa that you already cooked to put in here, you can just use more quinoa. It's not a big deal. I like the cauliflower rice, and I already had it on hand, so I'm just going to go ahead and take a bite. Nice big chunk of that salmon. This is amazing. The veggies are still not completely cooked, so there's still a little bit of a crunch to it. You get a tiny bit of spiciness from the jalapeno. The salmon is cooked all the way through. This is so good. Guys, you have to try this. This is all Kaufman 1. The full recipe is on our website, knowthecause.com. Please make this. Please let me know how you like this. This is great if you miss brunch and doing brunchy things. This is perfect for that at-home brunch season. But go ahead and make it. Give it a shot. Let me know what you think.
As in the content of all these shows, folks, just understand, share with your doctor you're concerned with irritable bowel or Crohn's, that you're taking too many antibiotics and it might be causing diseases later on in life. I may be wrong on that, so always talk to your doctor. Thank you so much, Kerry OReilly, for being here, Dr. OReilly, and sharing that. Thank you, Abby. Absolutely tremendous. We'll see you next time. Bye-bye.